Chronic non-communicable diseases, referred to as chronic diseases or NCDs, refer to a general term for a class of diseases with hidden onset, long course and prolonged illness, complex and lack of definite biological etiology, and some unconfirmed diseases. Chronic diseases include neoplasms, cardiovascular diseases, chronic respiratory diseases, digestive diseases, neurological disorders, mental disorders, substance use disorders, diabetes and kidney diseases, skin and subcutaneous diseases, sensory organ diseases, musculoskeletal diseases, and other diseases. To this day, chronic diseases are still the main cause of disability and death worldwide. Since health equity is one of the core principles of healthcare in China, understanding how the burden of chronic diseases vary across different provinces is essential to develop effective interventions. To this end, researchers from the Chinese Center for Disease Control and Prevention set out to shed light on how the dynamic evolution of the burden of chronic diseases has evolved from 1990 to 2021 in China. Using data from the Global Burden of Diseases, Injuries, and Risk Factors Study, or GBD, they analyzed chronic disease-related deaths and disability-adjusted life years, or DALYs, in China. The researchers also examined differences in chronic diseases due to gender of the individual. From 1990 to 2021, the disease burden of chronic diseases in China is on the rise. In 2021, 10.64 million people died from chronic diseases, accounting for 91% of all deaths. Cardiovascular disease is the leading cause of death, with 5.1 million deaths in 2021, showed an increase of 103.7% from 1990. Followed by neoplasms causing 2.8 million deaths with an increase of 84.3% from 1990, and chronic respiratory disease is the third leading cause of death, accounting for 1.33 million deaths in 2021. Musculoskeletal diseases and mental disorders, although rarely causing death, they still pose a huge disease burden in China. Especially musculoskeletal diseases, by 2021 have become the third leading cause of life loss caused by chronic diseases. Among the provinces, Qinghai, Xizang, and Heilongjiang had the highest rates for age-standardized mortality rates and life loss, or age-standardized DALY rate, associated with chronic diseases, whereas Shanghai, Hong Kong, and Macau had the lowest. Interestingly, chronic diseases caused a lower disease burden in women than in men. In 2021, the age-standardized mortality rate of chronic diseases in women was 438.2 per 100,000, while that in men was 765.9 per 100,000. This could be attributed to different physiological characteristics and behaviors between the sexes. For instance, the incidence rate of risk factors such as smoking and drinking is significantly higher in men than in women. However, women tend to have frequent mental health problems. Together, the findings of this study suggest that China needs to carefully allocate and optimize its medical resources and develop targeted interventions adjusted to each province and its unique demographic and socioeconomic characteristics to reduce the disease burden of chronic diseases, thereby promoting the overall improvement of national health levels.